Hello everyone, it's Dr. Teba and this video is about uterus and ovaries ultrasound probe positions. On the left side is a schematic diagram showing ultrasound positions. These dotted lines are the right and left costal margins. This is the umbilicus. This white box is the ultrasound probe and this red dot is the indicator or the orientation marker. This is the inguinal region. At this point is the symphysis pubis. For scanning the uterus, we place the probe between the umbilicus and the symphysis pubis joint. This is the hypogastric region. It is also called suprapubic region. Place the probe in the midline in longitudinal orientation. The patient's bladder must be full for transabdominal scanning. After locating the bladder, you will find the uterus posterior to it. Here is the endometrium and this is the cervix. You can also rest one end of the probe on the symphysis pubis to get better views of the uterus. Tilt the probe accordingly to scan the uterus completely. For scanning and measuring the endometrium, try to keep the probe parallel to the uterus. Heel-toe movements of the probe can be performed to align the probe with the uterus. This type of angling towards the patient's head is heel movement. For an anteverted uterus or antiflexed uterus, you can use the heel movement to align the probe parallel to the uterus. For a retroverted or retroflexed uterus, use toe movement. The probe is angled towards the patient's feet and this will align the probe properly with the uterus. To scan the lateral aspects of the uterus, move the probe laterally towards both the left and right side and you will get this image. This is the lateral aspect of the uterus. Now we will see how to scan the ovaries. The ovaries don't have a fixed position, but locating the internal iliac vessels is a good landmark to locate the ovaries. First we will see the right ovary. Move the probe laterally and slightly oblique like this to locate the right ovary. We will get this image. It is showing the ovary in longitudinal view. In a similar way, move towards the left side to scan the left ovary in longitudinal plane. We will get this type of image. This is the left ovary. Next we will scan the uterus in transverse view. Place the probe in the midline and rotate it 90 degrees anti-clockwise to keep it in transverse orientation. Tilt it superiorly and inferiorly to completely scan the uterus from the fundus to the vagina. This type of image will be formed. We can see the uterus in the middle and also the right and left ovaries on the sides. Now move laterally in this manner to scan the right ovary. By using the bladder as a window, you will find the right ovary at this location. You can rotate the probe in an oblique orientation. If there is some difficulty in locating the ovary, now you can move to the left side to scan the left ovary in transverse view. This is the left ovary. near the uterus in transverse plane.